Hello, all, this is Dr. Dheeraj Masapu. I'm a senior consultant in the field of neuroanesthesiology, and today I'm going to tell you the names of 10 specialties where it is taking significant time for people to succeed. Usually, around 45 plus only people are succeeding in these specialties. Even though you're trained in the best centers and institutes and having so many research and publications, also it is taking that much time. The reason is by default, all these specialties are very complex. You need to have a hands-on for a significant number of years, maybe a decade of hands-on experience should be there after your training. And the next important and the most important thing is for patients to believe you or for you to gain the trust of the patients. What is happening is you need to look little older, I think so that is what is another major factor in these specialties. So considering all these factors, what I am looking at is usually it is taking around 45 plus years for somebody to succeed in these specialties. Okay, hope you understood what I'm trying to tell you. So along with that, not everybody is succeeding. People who are actually developing that reputation in that particular area in the country among the peers and also the patients, and also who is having a kind of networking in that particular area in different ways. It can be any way, and also they run a kind of mentorship and teaching activities unto them. These are some of the common traits I see in those people who are succeeding in those specialties. So if you have all these things, then your chances of succeeding will increase, but that duration though nobody can change. At least one or two people outliers will be there who succeed in little earlier parts of their career, but most of them usually succeed after 45 years. Hope you're understanding what I'm trying to tell. So they are high risk and complex specialties. So this is about intro for the specialties which I'm going to tell now. So let us go into specialty one by one. I'll tell you why actually they are little difficult. So first, surgical. So most of them are surgical specialties. Okay, in medical specialties and service specialties like anesthesia, radiology, and other areas, it is actually age doesn't matter. Outcomes matter actually, because you are not actually directly judged by the patients. You are judged by the peers. You are judged by your fellow employees, in the sense doctors and all those people. So age is not a factor here. Your CV and your skills and those things will matter. But for these surgical specialties, age also is a matter. You need to look little older, only then patients will believe you. Okay, so the number one is cardiac surgery. Cardiac surgery, even after you finish your MCH from a premier institute, don't expect that patients are going to walk in your OPD. You are going to take significant number of years to do your first case. Okay, so usually what is happening is they join as an assistant to a cardiac surgeon who's doing good number of cases. And most of the times they end up only opening and closing the case. The crucial part will be done by the main surgeon. So you take a significant years to actually get to a position where you do the main stuff, and then you get a significant years of experience in that core part of anastomosing the vessels and all that, and then you actually build a OPD outside. When patients start coming to you, it will take significant number of years, right, for all these steps to cross. There is no easy way of doing it. You have to go through the same path. There is no side entry here. You have to go through all the steps which I told now. Okay, and same thing applies to neurosurgery. Even in neurosurgery, it is almost the same, but little advantage for neurosurgery is the trauma. If you're operating, for example, head injuries and those things, if you're operating, maybe their youngsters can shine if they're going to towns, or if you're working as a freelancer in smaller hospitals where trauma cases are there, they operate. But if you want to do the real complex stuff, again the same rules apply like what I told for cardiac surgery. Hope you're understanding. Okay, pediatric surgery is also similar, and patients who get the children to get operated usually will do research to the top level. They would have inquired to the top level, and then they would have got the kid to the person. So it follows the same philosophy. Oncosurgery is also same, vascular surgery also same, and ophthalmology. Ophthalmology, cataract surgeries, nobody does superb research and all that. For cataract surgeries, people can go to the nearest center, but for retinal surgeries and vitreoretinal surgery and those complex surgeries, again the same rules and regulations will apply. You need to wait for some time. Okay, but you need to be getting exposed to those cases during that waiting period. Transplant surgery, you don't have to think about it. Thoracic and transplant surgery also, the rules are the same. So transplants even more difficult because, and the transplant, so directly you don't get a patient. So institute actually gets, a priority list will be there when organ donation happens. Okay, brain death patients will donate organs. So there will be a priority list based on the institutions, and then institutions will actually have patient will go to institution basically. That is how it operates. So basically in that, see, no clinician is actually getting patients, right? So there is nothing like this one. But here to head the transplant surgery, it will take a significant number of years. So it will take, again, it will almost be that age of 45, which I'm quoting as a number in this particular video. And this is about the surgical specialties. So most of the specialties are surgical, but in medical also few areas are there. So interventional cardiology, that is where your stents and some kind of all the even for aorta repairs also would be done, and even valves also nowadays they're doing interventions. So all those procedures, when somebody is getting a procedure done in cardiology, usually this age is required, and less than that, I don't think it will work out. For general cardiology, OPDs and all that, it doesn't matter. So if nearby whoever is there, they might go. An emergency cardiac, if you're going to emergency, even there, which cardiologist is seeing and all that doesn't come into the play. But if somebody is going for a procedure again, all these things will come. And for example, if you're coming with a myocardial infarction and you went to the nearest center in the night, if it needs to be done, then usually whoever is available will do. It doesn't apply. The same thing will apply to interventional neuroradiology also. If it is interventional neuroradiology, usually it will be done by a senior person who has significant experience, because the coiling, clipping and all those things are very high risk procedures, right? There is a waiting period again there. So these are the specialties which, so I might miss some specialties. Many of you are putting inquiries, you missed this specialty, that specialty. See, these videos are for you to get an understanding about how the things are working out in the healthcare sector. These videos, I'm not trying to cover each and every specialty. I might miss few specialties. You have to understand that. These videos are done to give you a broader perspective of how actually the things work out, so that if you prepare in your mind, you will not feel bad later on. So that is why I'm doing it. But consistently, if you put your effort, most of them will succeed. People who are not succeeding in these specialties also, what I'm saying is, they will put their consistent effort for some years, but after some years they'll get demotivated and they won't put. But you have to have that vision in your mind that this is what I'm going to do. How many number of years are going to come in front of me, I'm going to face it, and I'm going to take it as a challenge, and then I'll go ahead. So whoever is consistently putting that effort without getting demotivated are succeeding. Only people are demotivated and who actually are not ready to put in that effort for decades of time are not succeeding. That's it. There is not a major rocket science in this. It is like a linear understanding. So hope this video is helping you guys in taking informed decisions before going into these specialties. I'm not discouraging you. All these specialties have a lot of glamour attached to that. If you are a neurosurgeon or a cardiac surgeon or some other vascular surgeon, you'll have a premium value when you go to some other place. So this much price, I think you can pay for that. Okay, so you'll have the recognition, right? This is the price you have to pay for that, and consistently put effort for years and years and years without getting demotivating, you will succeed. Okay, so thank you guys for following the video, and more videos will come in choosing specialties, and I'll guide you through your counseling session also in the upcoming months. Okay, thank you very much. As usual, Dr. Dheeraj Masapu logging off.